Hi everybody, my name is Gina James. I'm on the Incident Command Team for the Quinault Indian Nation. I'm also on the Quinault Business Committee. A few hours ago, the Business Committee met with the Incident Command Team and we decided to release the zip codes of individuals who are in isolation or quarantine for COVID-19. It is not a violation of HIPAA to release the zip codes. So we wanted to give you a general update in regards to COVID-19 cases and contacts. We currently have 6 cases that are Quinault citizens. All 6 of those are in isolation. 2 of those 6 are from zip code 98569. One is from zip code 98562. One is from zip code 98520, and 2 are from zip code 98587. Due to our active cases and cases from multiple counties, we currently have 36 people in quarantine. All 36 in quarantine. 4 of the 36 are from area code 98562. 2 are from zip code 98520, 6 are from zip code 98550, and 24 are from zip code 98587. 20 of the current 36 will be cleared from quarantine this weekend. So that's really good news, because that means that they did not have COVID-19 and they will be able to go about their daily business and go back to work or whatever. So QIN ICT is responding to cases and contacts as soon as we are notified. If you believe you were in direct contact with a positive case, please contact us at the COVID call center, 360-276-2445. If you were in contact with a person identified as a close contact who is now in quarantine, you are not at risk and do not need to quarantine, test, or report. All actual close contacts are identified during the case and contact investigations. When a person tests positive for COVID-19, so this means that if you were identified during that investigation, you will have been contacted by the Incident Command Team. And we also need to remember that even if you did come into contact with someone who was positive, you have to wait at least 8 days for a COVID test, because the virus does not become active in your body until after 8 days. So if you try to go in the next day, you'll have a false positive, and 7 days later you could be sick and unknowingly spread the virus to others because you went in too soon. So we wanted to report on what's the difference between isolation and quarantine. So isolation keeps someone who has tested positive for COVID-19 with or without symptoms away from others, even in their own home. If you test positive for COVID-19, your isolation period will last 10 days from the onset of your symptoms. If you are asymptomatic, 10 days from your test date. Isolating may be extended for those whose symptoms are worsening and or who have pre-existing health conditions. So if you're sick and you continue to have a fever, then you need to remain in isolation longer. The nation has an excellent resource, an excellent team. They will be calling isolated people and quarantined people every day to check in on them. And you will be given thermometers to check your fever. This will help you to determine when to go in to get a test after your designated period to test for COVID. What is quarantine? Quarantine keeps someone who was in close contact with a person who has COVID-19 away from others. Quarantined individuals must stay home for 14 days after their last contact less close contact and stay away from people who are at higher risk of getting very sick from COVID-19. So this quarantine means that you have not tested positive, but you could test positive during that time frame. So that's why you need to stay away from others, because you may still have the virus. Close contact is defined as being within 6 feet of someone who has COVID-19 for at least 15 minutes or more, and or you had direct physical contact with the person. You hugged or you kissed them, and you shared eating or drinking utensils, or they sneezed or coughed or somehow got respiratory droplets on you. The 15 minutes does not have to be at one time. It can be cumulative over one day, which is uh, it's very important to wear your mask, because if you were with someone who was positive and you wore your mask, then most likely, you won't get COVID, even though you will still have to monitor yourself. So it is extremely important to protect our families and community right now, by following phase 2 guidelines and COVID safety protocols. Studies show that a significant cause of the recent surge in COVID-19 infections is due to indoor gatherings, due to the worsening weather, the cold weather, and not being able to be outside and have that natural airflow. The Quinault Business Committee is encouraging everyone to limit Thanksgiving gatherings just to their household, and made this difficult decision to officially restrict gatherings to no more than 5 people who do not share the same household. So it's just really important. Across the United States, all scientists, health officials are asking that everybody not have their traditional large gathering, because they believe that this could be a super spreader, and cause our hospitals to be overwhelmed. Right now, many of them are near, the intensive care units are near capacity. So we really need to do everything we can to stop the spread of this virus. So the phase 2 guidelines are: high-risk population shall continue to stay home. If you have a high-risk person that has heart disease, diabetes, high blood pressure, other indicators that would make them more susceptible to get really sick, then they should stay home. They should try to do curbside ordering at the grocery stores, or have a family member pick up their groceries, or many of the supermarkets are offering delivery of groceries for a small fee. It's just really important that you try to help out your family member who may be at high risk to get their groceries or order from curbside, so they're not out in the general public. So outdoor recreation, including camping, is allowed for groups of 5 or fewer persons, not in the same household. I don't know who would go camping right about now. Maybe some people, but So next is gatherings of no more than 5 people not in the same household are allowed, and current funeral policies remain in place. Last is essential travel and limited non-essential travel within Grays Harbor and Jefferson counties are allowed. But this doesn't mean that if you have a medical appointment in Olympia or Seattle, that you can't go to that appointment. Of course, you're still allowed to go to any medical appointments, because that's, an absolute necessity for you to continue to maintain your health. So in closing, I just wanted to reassure the general membership, our community members, that the nation's incident command team is very well prepared, and we have a lot of great employees who are working around the clock. We offer food box delivery for those families that are in quarantine, medicine delivery, quarantine and isolation. So if you do become sick, please contact us so you can be signed up for those services. You'll have a nurse that checks on you every day, or a trained professional to make sure that, if your condition is worsening, that maybe you should go get checked out at the local clinic or hospital. I just want to thank everyone who is following the guidelines, and that you continue to wear your mask and wash your hands and stay home as much as possible, and that we all are praying that we come out of this crisis and that we continue to persevere. We acknowledge that this is hard on all of our families, and the nation is doing as much as we can to continue to keep everyone safe. Siap Kwal.